Hi, I'm Kemmesat with Mountain View Medicare Insurance. Today is part 3, which we're going to be talking about Medicare Advantage. Medicare Advantage is also called Part C in the ABC as far as Medicare is concerned. This is privatized insurance or Medicare replacement. Now the way Part C works is they're going to take your Part B premium that you're paying, 170/10 or the sliding scale up depending on how much money you make, and they're going to take you out of original Medicare and put you with a private insurance company. And there's a lot of private insurance companies out there, obviously, as you guys know. I'm not going to name any of the big ones, but I don't know if you believe this or not, but these private companies are more effective than government-run programs like Medicare or Social Security. With these private insurance companies, you're going to be signing up with an HMO or a PPO, and you have to follow rules in regards to referrals within that network. The difference between an HMO and a PPO with a Medicare Advantage plan is in HMO, you have a primary care doctor that you're encouraged to see, and the primary care doctor is in charge of your overall health. You need to see your primary care doctor for referrals if you're going to see a specialist. If your specialists change, or when you start Medicare, you tell him who your specialists are and he can write your referral for those. With an HMO, you have to stay in network. Now, the way the insurance companies build their plans is the copays to see specialists are typically less with an HMO. A lot of times you'll get more benefits with an HMO over a PPO. And the way a PPO works is you're encouraged to stay in network. You still have your primary care doctor. It's still usually free, and to see your primary care doctor and for your checkups and preventative scans and things like that. But you can see doctors in and out of network. You just pay more to see them out of network, and in network, your copays are a little higher, but you don't need that referral that you need in an HMO. So if you're used to being with an insurance company through your employer, you're going to be following the similar rules. What you'll find, though, is these Advantage plans are often better than the group coverage that you've had with your insurance companies. Unless you're working with oil company, financial institute, sometimes the school systems have pretty good insurance. But for the most part, this is going to be better insurance than you've had in your life. With these Medicare Advantage plans, you're also going to get extra benefits. Most of these plans come with prescription drug coverage included. They also come with dental, vision, hearing coverage, and the majority of the plans come with free gym memberships as well. Medicare Advantage plans also have maximum out-of-pocket limits, meaning that there's a limit to the amount that you can pay each year. So it makes it a lot better than having that 20% unlimited liability. They've set a limit with an Advantage plan, and that's the most you can spend. There's also copays with Medicare Advantage plans. These copays are affordable. We're not going to talk about the amounts, but each time you go and see a specialist, there's a set fee, an affordable one you're probably accustomed to. Hospital care, emergency room, there's affordable low fees for these services. Also, the big thing here is this only costs you, if you're entitled to A, your Part B premium. So with the Medicare Advantage, every insurance company is going to have, since the cost is all the same, it's the Part B premium, each insurance company is trying to incentivize you to come to their network with different formularies for prescription drug medications, different lower copays, lower max out-of-pockets. They'll also include more or less dental coverage, more or less hearing coverage. I call them like incentives almost to bring you to their company, since when you're looking at it, it's, well, who has the most coverage are my doctors. That may not be it. You may still be able to choose between 4 or 5 different plans, and then you can get down into the details and see which one is the best for your specific situation. Medicare Advantage plans have high member satisfaction. 27 million people were enrolled in Medicare Advantage plan in the United States last year in 2021. 93% satisfaction rate among people who had Medicare Advantage plan, and 25% savings over original Medicare. If you compare Medicare Advantage to original Medicare, it's actually going to cost you less than original Medicare. Original Medicare, you have your Part B premium, and you also have to pay for prescription drug coverage. With a Medicare Advantage plan, the prescription drug coverage is included, and you have that limit I was talking about, so it costs less and it's technically better coverage. It's also going to come with routine vision, routine hearing exams, dental as well, and it'll limit that out-of-pocket cost as we were talking about. When you're in a Medicare Advantage plan, it's best to stay in the network. If you're in an HMO, you have to see doctors in the network. If you're in a PPO, you're going to pay less to see doctors in that network. So choosing the proper network and making sure your doctors are in that network is going to be an important decision to make too. So you can work with a broker like myself to help you run your doctors and your specialist to see what networks they're in and what insurance they take. Also, another cool thing about Medicare Advantage is you're going to use one card for just about everything. You're going to give that card for, if it has dental, vision, and hearing coverage, you're going to use that card. You're going to use that card anytime you see your specialist. Another benefit of Medicare Advantage is your primary care doctor and your visits and your preventative care is included at no cost. I understand Medicare is complicated, and I'm here to help walk you through this process and make it as simple as I possibly can and help you understand it. I do want to tell you again, there's no charge to you to work or hire a broker like me to work for you. I'm looking to build a relationship. This isn't a one-sale business. This is you working with a broker the rest of your life, and that's the relationship that we're trying to build. Feel free to reach out to me. I'd love to set up a meeting, talk to you, and answer any additional questions you may have.